So let us begin with Ellen's keynote study streak and one more day. And now today we have a group of remedies which are going to be very helpful for you all, especially in injuries. So the first remedy that we'll be discussing is Arnica montana. In the first line, we see that there is mentioned that there are bad effects resulting from mechanical injuries, even if received years ago. So, patients who have had received injuries, even many years ago, they need to be given this medicine as an intercurrent or as a treatment, part of the treatment, because their sufferings may not have subsided or have caused long term effects for them to overcome it easily. So that is the first indication, especially if it is a very soft part or an internal organ that has been injured a lot with some injury, and in those cases we'll think of giving uh, arnica for as an intercurrent or as a part of treatment for a few days or few weeks, and then go back to the indicated medicine. Next we have is nervous women, sanguine, plethoric persons, lively expression, and very red face. So you can see and understand that there is a plethora which is kind of you know rushing to the upper part of the body. The upper part is very much red and flushed, and this is the keynote of arnica throughout its entire different presentations of cases. You will see that arnica has this kind of upper part of body which has lot of redness, flushing of arteries and congestion, and especially the upper part which is mostly congested, red and full. Arnica is adapted to those who remain long impressed by even slightest mechanical injuries. Next we have is unconsciousness when spoken to answers correctly, but unconscious and delirium at once return. So there will be cases like simple fevers, there will be cases like comatose patients who will respond, and they'll respond correctly even if they are unconscious. If they are woken up, they'll respond correctly and go back to sleep, or they are unconscious feeling once they are once they have answered whatever they have been questioned for. And that is the characteristic of arnica. There are other remedies which have same characteristic, but little bit difference, like someone will talk slowly or someone will talk half correctly, half wrong, and go back to their unconscious state. But every remedy has its own nature of expression, and that is what we see in Baptisia. In fact, we also see this in same thing in Helleborus. Helleborus would probably answer very slowly, like a dull condition which is going on for many days. So, okay. Next we have is one very key indication of arnica which has been used in classical practice, in mind method, and in all the different schools of thoughts, which is that arnica patient will says that there is nothing the matter with him. Whatever be the case, even if it is grave pathology, they will tell you that no, I am feeling totally fine. There seems to be not much of a trouble. They don't understand crisis which is lingering around themselves or in their body. And that is what many patients will tell you, that I am totally fine, and this runs through the remedy, whether it is in simple cold, cough, fevers, or the extended deeper pathologies, or traumatism, rheumatism, or comatose patients. Then you have in arnica sore, lame, bruised feeling all through the body as if beaten, traumatic affections of muscles. So wherever in your cases you see that there is overuse of muscle which has happened. We are a group over here in my region where we run marathons, and if the medicine is taken, arnica is taken a day before or the day of the long races, it is going to give a kind of a relief of trauma, even if it is going to set in, and the recovery of those people is much faster if the traumatism is covered by the medicine. This is one of the very important key indications of arnica, that there is traumatic affections of muscles, overuse of muscles anywhere in any part of the body, think of arnica. The patient is nervous, cannot bear pain, whole body oversensitive. So now you see there is second or third place where it is mentioned that it is oversensitiveness, like the remedies chamomilla, coffea and ignatia. So these are the group of remedies which are highly sensitive remedies, and once you try to understand the sensitivity from the materia medica, when the patient will explain you and talk about that pain 10 times in clinic, it's not anxiety, it may probably be the oversensitivity, or he may not allow examination in a peaceful way. There will be some kind of a resistance, or there will be more shouts that he will extort when you are trying to examine him. So that is what is sensitivity for arnica is all about. It will be mostly in the rheumatic complaints, or also in the other parts of the body wherever the complaint are, and that is what arnica will help you with. One of the characteristics which we see, everything on which he lies seems too hard, complains constantly of it, keeps moving from place to place. So there is a kind of a hard feeling wherever he lies and keeps on changing places, and he is trying to look for a spot which is comfortable for him, but it does not ever come to him because the whole body is highly sensitive. That is the whole problem, and not the place where he is resting. Opposite presentation we see in baptisia pyrogen, and restlessness we see in the remedy rust ox. Then you have one of the characteristic symptom which is mentioned twice, but it's important, which is that there is heat of the upper part of the body and coldness of the lower part. Face or head and face alone is hot, but the body is cool. Many patients that I have seen and many fever cases that I have seen, I have treated using arnica based upon this indication, where only the upper part of the body is very hot and the lower part is very cold or can be lukewarm. If the other symptoms match, which is the body pain or the bruise soreness, then arnica can be indicated. So Dr. Mehal Vatalia, where are you from? And I am in Mumbai, a suburb of Mumbai. And is there any offline learning course? So if you are in Mumbai, I have my clinic, and if you wish to join for observation, you can definitely contact me. I'll also be conducting, I have also conducted many online sessions which you can join from wherever you are located. So the links are already available. There is a WhatsApp number on the profile. It is mentioned on YouTube. If you are watching, those who are watching, the viewers, they can go to the community tab or the YouTube shorts and see whether there is a number mentioned, and you can get the recordings of the past workshops which we have done. So I was at this point where arnica can be indicated for upper part of the body which is hot and lower part which is cool, and mechanical injuries, especially with stupor from concussion, involuntary feces and urine. So you have this kind of a injury which is running through the remedy everywhere, and with that there is kind of an involuntary feces and urine, which is a key indication for arnica. Next you have is after injuries with blunt instruments, which is also the case with Symphytum. Compound fractures and their profuse suppurations call for Arnica and also the remedy which is Calendula. Concussions, contusions, results of shocks or injury without laceration of soft parts prevent suppuration and septic conditions or promotes absorption. So you have to see this beautiful analogy which is telling you that Arnica is a medicine which is not only given for injuries but also where there is dropsy. If you go in different repertories, you will see that Arnica is mentioned alongside remedies like sulfur, kali iode for absorption. What does it do? It kind of absorbs the excess fluid which is secreted. It's kind of an exudate which is not required to be there but is there because of the joint inflammation or the pathology which is going on. Arnica is bound to absorb those exudates back into where they belong, or it will be excreted through the lymphatic system. That is what you should understand when you prescribe for pathological cases where you need the medicine to absorb something that is an exudate and bring it back to where it belongs or remove it from the body. Once you understand these things, and it's also mentioned that it is indicated for septic conditions, there will be much ease of practice and you will be able to prescribe on the basis of pathology directly rather than thinking about what to give, how to give and when to give. Next you have is hydrocephalus. It is indicated very strongly where there is concomitant deathly coldness in the forearm of children. If it is there in diarrhea, it is bromium. If the forearms are cold and the condition is hydrocephalus, think of Arnica. Eyes also are affected very badly with in Arnica, in provings and in cases where we see there is conjunctival or retinal hemorrhage with extravasation from injuries or cough. Ledum pal and Nux vomica are the top other two remedies, and Arnica can also be thought. There is belching, eructations, foul, putrid, rotten eggs, dysentery with ischia, fruitless urging, long interval between the stools, constipation, rectum loaded feces will not come away, ribbon-like stools from enlarged prostate or retroverted uterus. So you have this kind of action on the gastrointestinal tract also, which is very important for Arnica, where it kind of has dual action on the diarrhea as well as the constipation cases. The only difference, the only key symptom which we need to find out is that we need to find out whether there is coldness of one part of the body and upper part of the body which is hot, or you can find out whether there has been a kind of a stasis which is there or kind of an injury which is there because of which there is a problem in the local area. Then you have meningitis after mechanical or traumatic injuries from falls, concussion of brain, when suspecting exudation of blood to facilitate absorption. So you see that the second time you have the word which is promotes absorption or facilitates absorption, and any of those cases where there is excess of fluid which is not which should not be there, think of Arnica as the top remedy. Then you have apoplexy, loss of consciousness, involuntary evacuation from bowels and bladder. In acute attack, it controls the hemorrhage and aids the absorption. It should be repeated and allowed to act for days or weeks unless other symptoms call for a remedy. There is paralysis in cases, and you can think of Arnica if it is left-sided. The concomitant being the strong pulse and stertorous or sighing breathing and muttering delirium. Next you have is extremities which have gout, rheumatism with great fear of being touched or being struck by persons coming near him. So in the initial part of the Arnica remedy from the Allen's keynotes, you read about this kind of a oversensitivity which was there. The same goes along in all the parts of the body, and for rheumatism it is even more aggravated by least touch or least approach of person, because the person feels that he will be injured by them. Next you have is cannot walk erect on account of bruised sort of feeling in the pelvic region. Soreness of parts after labor prevents postpartum hemorrhage and puerperal complications. Retention or incontinence of urine after labor, the remedy being opium. So you can see its action on those areas where nervous system is highly involved and there is involvement of inability of the part to perform function. That is where arnica will be involved. Tendency to small painful boils one after the other. We saw this also in heparsal, we saw this in sanicula, we saw this in other remedies which have strong action on the skin, and there is tendency to small boils, but the boils of arnica will mostly come in areas where there is thin bone present, and this is almost like calcarea picrata, which will be also be indicated in such areas. If it is very reddish in nature, it will be sulfur, which can be thought of. Modalities of arnica we come, and we see that it is aggravated at rest, when lying down, from wine, amelioration from contact motion. Rustox and Ruta are the other similar remedies. Arnica we see it is complementary to aconite, hypericum and Rustox. Hypericum is one of the remedies which I will be discussing today. And arnica follows well aconite. So in cases of injuries where there is lot of anxiety, you can see that there is kind of a mental anxiety and restlessness, you can think of aconite and then follow it up with arnica. Aconite will bring down the anxiety, and for absorption and for relieving the local parts, you can think of arnica as a medicine. Then you have also arnica following well apis, hemamele, ipecac, veratrum, and is also followed by sulfuric acid. So one of the most underestimated remedies for injuries is sulfuric acid, and it has its own class of action. We will study it in all the acids when we cover all the acids. And if there is spinal concussion where road traffic accidents have happened, think of this medicine with hypericum, or you will need to alternate with arnica, calendula or hypericum, something like that as a combination. Next we go to is calendula, one of the top medicines all the homeopaths give, especially the ointments, but it is most beneficial if given in tincture mixed with distilled water, and also internally in cases where there is laceration of the parts. So there is traumatic affection to secure union by first intention and prevent suppuration. In cases where loss of soft parts is there and union cannot be affected by adhesive plaster, think of calendula. There will be external wounds with or without loss of substance, torn or jagged looking wounds post surgical operations, to promote healthy granulations and prevent excessive suppuration and disfiguring scars. So this can be cases like after appendicitis or laparoscopic surgeries, or you can see that there is post-delivery, post-cesarean sections, etc., where the scar has remained or the tissues are badly affected. Think of calendula internally as well as externally to aid for the rapid healing. One of the interesting things is, along with Allium cepa, if you see that calendula is indicated where the nerves have been damaged, especially there is neuritis from lacerated wounds. Also another remedy is hypericum, where there is traumatic and idiopathic neuroma of that part, and exhaustion from loss of blood and excessive pain. There is rupture of muscles, tendons, and lacerations during labor, which I already conveyed. Wounds are penetrating articulations with loss of synovial fluids. So, all those operations of joints or road traffic accidents where they have recovered but still the nerve endings are open and they need some support to join. Probably they will take 6 weeks to recover. With calendula, it may take 3 to 4 weeks, also much faster. There will be wounds with sudden pain during febrile heat, constitutional tendency to erysipelas, like the remedy sorinum, and old, neglected, offensive, threatening gangrene cases with sulfuric acid. You can think of calendula. You can think of these remedies which are mentioned in the brackets as complementary or as one after the other or as a comparison, and then prescribe one of them or both of them one after the other as the need be. It is not always that the single remedy will help, especially in acute cases. You will need to employ and make your own materia medica and way of prescriptions to succeed in your practice. So calendula, you can see, is very specific for clean surgical cuts, lacerated wounds to prevent excessive suppuration. There are ulcers, irritable, inflamed, sloughing which is there. Varicose ulcers, especially those patients who come with varicose veins and ulcers that have been troubling them. We should think of Arnica. What is the beauty is that you should think of calendula rather. The beauty of calendula is that it helps in bringing the tissues together. If it is given internally on every alternate day along with your constitutional medicine, it will probably heal the wound faster, along with the external application of calendula and the constitutional medicine which is going with the patient throughout the treatment. Next you have is there is pain as if it is beaten, like Arnica, and excessive secretion of pus. Complementary, like in Arnica, we see sulfuric acid was one of the most closest remedies. Here also there is sulfuric acid as well as salicylic acid which are very close. Hepar sulf is very close, and you can see that Hypericum and Arnica are mostly closely related to this remedy. And as I told to you that it can be given internally as well as externally. Most homeopaths give externally, but they forget to give internally. There are good indications, and if you know where to employ it, your patients will improve very faster. So we covered Arnica, we covered Calendula, and next we go to is Hypericum from the H series. So if there are nerve affections which the patient has been complaining of, especially of the spinal cord, think of Hypericum. After especially fall on the coccyx. So if I may tell you that if there is a fall on coccyx, there is a very slow recovery of patient. Allopathy has no treatment, and they just give a coccyx ring for the patient to take and sit on it so that the coccyx is not bearing the weight of the body. In homeopathy, if you give Hypericum 1m or 10m for few weeks, you will see the results. It can depend to give 200 also, depending on case to case. There is punctured, incised, lacerated wounds, sore and painful, and especially of a long duration, which is very important. If there are contused wounds, think of Arnica and Hemambelis. If there is lacerated and sore and painful, there is Ledum. To differentiate this is a bit of a tricky nature. You can observe it, and you can also get a subjective sensation from the patient to understand and prescribe. Sometimes it's also about your observation, whether you see and look to the wound and decide whether it is contused or it is lacerated. Lacerated means it's like scraped, and contused means it has been hit by something. Then you have injuries from treading on needles, pins, splinters, from rat bites, and the remedy Hypericum also prevents lockjaw, which is a form of stiffening of the muscles, kind of a tetanus or symptom of tetanus also. Prevents integrity of tone and lacerated member when almost entirely separated from body, like the remedy Calendula. So you have these cases, can be gangrene, can be any grave pathology where the part is almost kind of separated, or the nervous system and the circulation is cut off. Think of Hypericum. So now you can the terminal ends of the body, the fingers, the toes, all those parts will require Hypericum. If you read further, you will see that there is injury to parts rich in sentient nerves, fingers, toes, matrices of nails, palms or soles, wherever the intolerable pain shows the nerves are severely involved, or of tissues of animal life as hands and feet. Tetanus after traumatic injuries, think of Hypericum. Also think of physostigma in those cases. In the head we have vertigo, sensation as if head became suddenly elongated at night with urging to urinate. This is a sensation I already conveyed in many different sessions, that the sensations are difficult to elicit. If you can, well and good, otherwise focus on the modalities that will give you much better clues and faster understanding to the remedy. Headache after a fall upon the occiput with sensation as if being lifted up high in the air. Great anxiety that she would fall from this height. Nervous depression following wounds or surgical operations. Bad effects, removes the bad effects of shock and of fright from mesmerism. So there are patients who get a bit nervous or anxious after they have been operated upon, because they don't know how they will recover, how faster they will recover. Think of Hypericum in those cases, it will probably help you heal them faster. Convulsions after blows on the head or concussion. So very similar to Arnica, but the only difference is that spine is involved, and the other thing is that the terminal ends of the body, the coccyx, the fingers, the hands and the toes are mostly affected. So next we come to is spine. After a fall, slightest motion of arm or neck extorts cries. Spine is very sensitive to touch. So this gives you a very beautiful description of a pathology known as cervical spondylosis. All those patients that land to your clinic with radiating pain, especially from the cervical region, they will probably need this medicine. It will give them a boost to their nerve, relieving the stress in the nerves which they have. So you can give this medicine solely, or you can alternate it with your constitutional treatment. That will probably help even faster. Next you have is something that is crushed, mashed fingertips, and also there is ulceration which has happened, and Hypericum will prevent that. There will be bunions and corns when the excruciating pains are there, and if they are involving nerves, the sensations have lost or barely there. Think of Hypericum very strongly. You have the remedies Arnica, Calendula, Ruta and Staph in comparison with Hypericum, very closely remedies, and in fact Staph is one of the very good remedies for injuries to nerves. So if Aconite and Arnica we saw in the previous few minutes ago, Aconite and Arnica have been given, but it has not helped much. Hypericum will probably cure it faster. Next we go to is the remedy Ledum Pal from Allen's keynotes. It is one of the top remedies you should think of in cases where there is uric acid deposits and uric acid diathesis. So you can read now: rheumatic and gouty diathesis and constitutions abused by alcohol. Similar remedy is colchicum. So you can see that there is kind of a emaciation of affected parts similar to graphitis. Very surprising mention of graphitis over here. There is complaints of people who are cold all the time, always feel cold and chilly, lack of animal vital heat. So one of the things that you need to understand from the materia medica and from the repertory is that lack of animal or vital heat is mentioned in many remedies, and if you try to understand that, then they don't have their own energy to thermoregulate, and in those cases we can think of these remedies mentioned, for example sepia, silica, ledum. You can think of calcarea, you can think of sorinum, you can think of heparsulf, and on those lines. Parts which are cold to touch but not cold subjectively to the patient. So the patient may not feel cold, but if you check, you will feel that there is lot of coldness. In some affections, warmth of bed intolerable on account of the heat and burning in the limbs. So the part patient will tell you that internally I am feeling very hot, there is lot of burning, but if you check, there is coldness. That is the contradictory modality or contradictory observation which you will pick up from the Ledum Pal cases, and this will help you prescribe. Punctured wounds by sharp pointed instruments as owls, nails like we saw in Hypericum, rat bites, stings of insects, and especially mosquitoes. Long remaining discoloration after injuries, black and blue places become green. So those cases which have been long time affected with some injury, the parts have become black or blue because the circulation has been kind of cut off, or there is stagnancy or stasis. Think of Ledum Pal. It will probably also establish a good concurrent circulation, and the part may become rich with arteries and oxygenated blood again. Pains are sticking, tearing, throbbing. Rheumatic pains are aggravated by motion, like we see in Rustox, but Rustox is more like initial motion aggravates. And in Ledum Pal, it is aggravated at night and by warmth of bed and bed covering, like we see in Merksol. In fact, Ledum Pal is one of the very good remedies for skin troubles as well. We will see it in the skin in few seconds. So, the patient of Ledum Pal in the cases of such cases is better by keeping the feet in ice water, like the remedy Sicalcorn. Hemorrhage in the eyes, especially the anterior chamber after iridectomy, contusion of eyes and the lids, especially if much extravasation of blood, ecchymosis of lids and conjunctiva. So those cases of retinal hemorrhage, you can think of the cases, you can think of Bothropes, you can think of Ledum Pal, you can think of Crotalus horridus as well. So for Ledum Pal, there are a lot of things mentioned in the Allen's keynotes, and there are many points for you to prescribe it, and I guess this is going to be a helpful tool for you to prescribe in a quick way to such patients. Next we have is rheumatism or gout, which begins in the lower limbs and ascends. So patients will tell you that my complaints begin few months ago in the legs and now my hands are affected. Legs are not so much painful, but hands are affected. You now see that there is ascending rheumatism. In those cases you can think of Ledum Pal. If it is opposite, think of Kalmia. Also you can see that there is painful and arthritic nodosities. Ledum Pal affects the left shoulder and the right hip joint, so there is a crosswise connection of complaints. And there is swelling of the feet up to the knees of ankles with unbearable pain when walking, as from a sprain or false step. Ball of the great toe swollen. So all those patients who have been coming to you with uric acid deposits or high uric acids, their right toe, left toe, whatever toe, or their thumbs or fingers have started depositing uric acid crystals. Ledum Pal will help in relieving the pain. If the modalities and observations are correct and constitution, it will probably remove those crystals from there and drain them. If not, then you will require benzoic acid or some other medicine. One of the cases I have been treating with Thalaspi bursa pastoris, very nice and interesting uric acid diathesis which came with the help of her concomitant symptoms. So in Ledum pal, like we see in Carboanimalase, natrum carb, natrums, and all those remedies where there is easy spraining of ankles and feet, Ledum pal is also indicated. Then you have intense itching of the feet and ankles aggravated from scratching and warmth of bed, like pulsatilla or like rustox, red pimples and tubercles on the forehead and cheeks, as in brandy drinkers, and they are stinging when touched. So it is a good remedy for pimples as well. If you know that there is hardness of pimples and they are deeply red looking pimples. You can compare Ledum pal with Arnica, Crotalus, Hemamelase, Bellispur, Ruta in traumatism and in conam where the injury has been long standing and especially to the soft parts. So we completed Arnica, Calendula, Hypericum and Ledum pal. Now we go to the next remedy, which is Ruta, but I guess Physostigma is a small medicine. We can cover that also because it's more of an injury remedy also and also works on the nerves. So Physostigma, uncommon mental activity, cannot stop thinking. Very less prescriptions will be based on this, but you will get more prescriptions to be based upon tremors or tremblings of young persons from mental or physical disturbances. So those cases where early Parkinson's have developed, think of Physostigma. Early Parkinson's or any kind of Parkinson's, think of Lolium temulentum also, which is tomato. Great prostration of muscular system, impaired locomotion, idiopathic or traumatic tetanus. So this is the same case like Hypericum, like Ledum pal, for sudden spasms of the body seeming to look like traumatism, and they are brought on or aggravated by slightest breath of air from person passing, also causing trouble. In the eyes, in the vision especially, you see that there is dim vision, there is blurriness, films or objects are mixed, and there is pain after using the eyes. So all the remedies which are working on injuries, you will see that they are mostly the ones that will work on the eye also. You see Ruta works well on the eye, you see Ledum pal works well on the eye, you see Arnica works well on the eye. So all those injury remedies, because the eyes are the most sensitive region and also they have kind of work on vision, and the remedies also have their sphere of action on those areas. Sorry. Next we have is patients who develop early cataract, Physostigma in low potencies like 30, or if you get in 6x or 6c, will probably help, and in cases where there is squint which is developing, think of Physostigma. You can compare Physostigma with belladonna, conam, curare, gelsemium, hypericum and strychnine. So next we go to is the remedy Ruta from the Allen's keynotes, and for Ruta we see again there is lot of soreness in those parts where there is the patient which is lying. It is bruised like bacteria, like pyrogen. There is more of restlessness and patient turns and changes position all the time when he is lying down, like the remedy Rustox. And after a fall, like there is a pain or sore bruisedness in Arnica. You will see that in Ruta as well. There is aching in and over the eye. So I already told that all the injury or majority of the injury remedies will work very good on the eye, and you have it here for patients who have developed a lot of eye complaints in the early days, or they are working constantly on the computer, not exercising their eyes, think of Ruta. If they also have blurred vision, or they have fine work which is a minutely intensely involving work like watchmaking or jewelry, and they look intently, they don't shift their vision. So the best way to prevent these things to happen from you also can be that if you're looking at one thing for a long time, after few seconds change your focus to something which is long. This will probably give you an accommodation of something that is far and close, along with a combination, rather than just focusing on one thing and then missing out on something that is far. Then you have amblyopia or asthenopia, which is weakening of the eye muscles from overstrain of the eyes, from overuse in the bad light, fine sewing, overreading at night. People who watch mobiles in the dark light can be thought of giving Ruta. If they have eye complaints, they have misty and dim vision with complete obscuration at a distance. Eyes burn, ache, feel strained, hot like balls of fire. This will be expressed by the patient subjectively, and there will be observation that there is twitching of the lower eyelids or spasms of the lower eyelids. In the respiratory system, you see that there is phthisis after mechanical injuries to the chest like malepholium. One of the another aspects of many of these injury remedies is that they also work on the gastrointestinal system. For example, in Ruta, I have had given it to one of the patients who had cancer of the rectum. I gave it in Ruta mother tincture and it helped her relieve the pains. It has constipation, inactivity or impaction following mechanical injuries like the remedy Arnica. There is prolapse of rectum immediately on attempting to pass the stools, and frequent unsuccessful urging. So very less is indicative, it's a very common symptom, but I had given it based on the indications from Boric, and there was just a mention of cancer of rectum of that part, so that's why it was prescribed. Then you see that urinary system, there is pressure on the bladder as if it is constantly full, and it continues after urinating, and it does not, patient cannot retain the urine. He has to frequently go and urge, otherwise it would cause him trouble. There is scanty green urine or involuntary urine. In cases of injuries to the bones or mechanical injuries, or there is frequent dislocations, think of Ruta along with Symphytum. There is lameness after sprains, especially of the wrists and the ankles, think of Ruta. In fact, you can think of Ruta in cases where there is more of ganglion, especially on the wrists. It will help to relieve. Along with that, you can think of benzoic acid as well. If there is an acute sprain, think of Ruta. If there is chronic sprain, think of the remedies natrums or the remedy strontiumca, which is very strongly acting on the ankle region. Backache of Ruta is very characteristic. The patient will feel better by lying on the back. In the skin complaints, you will see that there are smooth and soft and flat warts, especially on the palms of the hands. If they are on the back of the hands, think of Dalkamara. If they are on the palms, think of natrums, think of Ruta. Ruta can be similar, or you can compare Ruta with Arnica, Argentum nitricum, Kona and Euphrasia, Phytolacca and Rusthaus. And last but not the least remedy we come to is Symphytum, which is one of the top remedies all orthopedics should use, but they don't use because they are not pro-homeopathic. But there are few orthopedics which do depend on homeopathy. If they are using Symphytum, they are doing great service to the patients. Excellent remedy for fracture or mechanical injuries, facilitates union of fractured bones like the remedy Calcarea Phos. There is a kind of a pricking pain in some patients after they have injuries. Those are the cases that will require Symphytum. Favors the production of callus when the trouble is of nervous origin. So con cases which have nervous origin or from stress, you can think of Symphytum as an adjunct to your constitutional medicine. Irritability at the point of fracture, periosteal pains after the wounds have healed, mechanical injuries, blows, bruises, thrusts on the globes of the eyes. All those cases which have injuries to the eyes or the globe of the eye, orbit region, think of Symphytum primarily, then Ruta or Ledum pulp. Pain in the eye as after a blow from an obtuse body. Snowball strikes the eye, infant thrusts the fist into the mother's eye. Think of Symphytum. If there is tissues which are around the eye, think of Arnica. So if there is pricking pain in those parts, think of Symphytum. If there is bony pain, think of Symphytum. Similar other remedies are Arnica, Calendula, calcarea frost, fluoric acid, hepar sulf and silica. So we finish around 5 to 6 remedies today, and I see some question in YouTube which is remedies for pain under feet after exhausted. So good question. If anyone has any more questions, please feel free to ask. So Dr. Poonam, I would answer that, and first thing we need to ask is that whether there is more of any sensation in the patient, and if there is any sensation we can classify from that sensation to the group of remedies which cause that sensation. For example, if there is burning in the soles, we can think of medorinum, sulfur, sanicilla. If there is no burning but just the pain and exhaustion, which is bony pain in nature, think of Arnica, or think of just the bony remedies. We can think of Ruta as well. But it will mostly be more valuable if you know the modalities, because to classify and understand the modalities is more important. It can come as simple as rust ox as the remedy, and how to reduce taking insulin in homeopathy. So it's a big answer which cannot be answered in this session, because it needs you to understand cases which can be seen what happened before and after. So maybe in future, if time permits, I will be taking that as a session. Meanwhile, in Instagram, if anyone has any queries, please feel free to ask, so we can make a move. So Dr. Poonam, you have answered your question only. Insulin 3x does the work. You can try it. There is something like every homeopath needs to try his own formula and work it out for the patient. If it works well for you, good for you, and you can share it with others wherever it does. So we come to an end, and I guess no one in Instagram or YouTube has any more questions, so we make a move. And thank you all for joining. Tomorrow evening 5 p.m. we join again with another group of remedies which will be taken up from Alan's keynotes. We are almost about to finish. Hopefully we'll finish it in this month.